Hi everyone, this is Shiny, Assistant Professor, Emmanuel Arasa, College of Pharmacy. In this presentation, I am going to discuss about lymphatic system. Lymphatic system forms a closed network of lymph vessels through which lymph circulation all over the body. The flow of lymphatic fluid is unidirectional from tissue space to blood. Interstitial fluid is produced by filtration of components of the blood plasma through the walls of blood capillary. Coming to the introduction, lymphatic system is a part of the circulatory and immune systems. It is made up of lymph vessels, lymph nodes, and lymphoid organs such as spleen, thymus, and tonsils. Its main roles are maintaining fluid balance and protecting the body from infection by producing immune cells called lymphocyte. It protecting the body by producing the immune cells called lymphocyte. The system acts like a drainage network that collects excess tissue fluid and return it to the bloodstream, preventing fluid accumulation, that is edema. Next, formation of lymph. Lymph is a clear watery liquid. Blood plasma constantly leaks from capillary into tissue spaces, forming tissue interstitial fluid. Most of this fluid return to blood capillaries, but some enters lymph capillaries and become lymph. About 20 to 21 liter fluid leaks from capillary daily. Approximately 17 liters return to bloodstream and 3 to 4 liters enters lymphatic system and become lymph. Except for plasma proteins, the composition of lymph is almost similar to the plasma and interstitial fluid. One of the major function of lymph is transportation of plasma protein oozing out of the capillary beds back to the bloodstream. In the process, it also carries larger foreign particles like bacteria and cell debris away from damaged tissue. They are often filtered and destructed by the lymph nodes. Lymphocytes present in the lymph circulate the lymphatic system through the different regions of the body. Next one, composition of lymph. Lymph is similar to plasma but contains fewer proteins. It mainly contains water and solids. Water is 96% and solids is 4%. In the solid, it contains cellular components like lymphocytes and inorganic compounds like glucose, lipids, carbohydrates, proteins, and amino acids. And also it contains inorganic substances like sodium, calcium, potassium and chloride and bicarbonate ions. These are the composition of the lymph. Lymph form lymph from the intestine contains more fat because it absorbs dietary lipids. Next, components of lymphatic system. Lymphatic system consists of lymph, lymph vessels, lymph nodes, lymphoid organs like spleen, thymus, bone marrow. Diffuse lymphoid tissue is tonsil and Peyer's patches. Next one is functions of lymphatic system. It maintains the fluid, that is fluid balance. It remove excess tissue fluid and return it to blood circulation. By returning it to blood circulation, maintain homeostasis. Next, transport of large molecule. Transport proteins and lipids that cannot directly enter blood capillaries. Next one is immune defense. It produces and activates lymphocyte that destroy pathogens. Next one, the component of lymphatic system, that lymphatic vessels. Lymphatic vessels starts as lymph capillaries which collect interstitial fluid. These join to form larger vessels and eventually form ducts that drain into veins. The important features of lymph vessels are it has thin walls and numerous valves that may prevent the black backflow of lymph. It has no central pump. It regulate the flow depends on skeletal muscle movement. It has main ducts like thoracic duct and right lymphatic duct. This thoracic duct drains most of the body lymph and right lymphatic duct drains right upper body. Next, lymph nodes. This has this has a bean shaped structure and strategically located along lymphatic vessels that filter lymph, eliminating waste and pathogens while housing immune cells such as lymphocyte. Lymph nodes are small bean-shaped structure locating along lymph vessels. The function of the lymph nodes are filtering the lymph and trap bacteria and viruses, activate immune response. They contain immune cells like lymphocytes, macrophages, and dendritic cells. During infection, lymph node enlarge, that is called as lymphadenopathy. Next, primary lymph organs are bone marrow and thymus. Bone marrow, site of blood cell formation, and B lymphocyte maturation is taken place at the bone marrow. Thymus is the site of T lymphocyte maturation, large in childhood, diseased with age. Decreased with age. The size of the thymus is decreased with the age. In childhood it becomes larger, and the age decreases, it decreases in size. Next, secondary lymphoid organs. These are sites where lymphocytes meet antigen and become activated, which includes spleen, lymph nodes, tonsils, Peyer's patches, malt. Next, spleen. Spleen is the largest lymphoid organ and is located in the upper left abdomen. It is located in the upper left abdomen. Functions of the spleen include filters blood, removes old RBCs, produces lymphocyte, stores immune cells. It contains white pulp, that is immune function, responsible for immune function. And spleen is present in vertebrates and is closely related to the circulatory system. One of the major functions of spleen is destruction of older RBCs. It is ductless gland found in the upper left area of abdominal cavity and is partly divided into compartment. Every compartment comprises of tissues identified as white pulp and red pulp. The spleen is made up of several red and white pulp units centered in tiny splenic artery branches known as central arteries. White pulp is naturally lymphoid with B cell follicles, a border zone around the follicles and areas rich in T cells that sheath antrioles. Pulp sinuses and pulp cords are example of the red pulp area. Dead ends make up the cords. Red blood cells must pass through microscopic openings in the sinusoidal lining in order to regain across to the circulation. Old, stiff, or damaged red blood cells are unable to enter the sinus. And some functions, some phagocytosis, hemopoiesis, immune response, storage of erythropoiesis. The splenic macrophages engulf worn out red blood cells, white blood cells, and platelets and cell debris, also microorganisms. In immune response, similar to lymphoid tissue, it is a center where multiplication of both B lymphocytes and T lymphocytes occur. When stimulated by the presence of antigen, the B lymphocytes enlarge and convert into plasma cells. Next, tonsils and Peyer's patches. Tonsils protects against inhaled or ingested pathogens. Peyer's patches, lymphoid tissue in small intestine that protect against intestinal infection. Next, disorders of lymphatic system. First one is lymphedema. It is a chronic swelling due to accumulation of protein-rich lymph fluid. Occurs due to impaired lymphatic drainage. Commonly affects upper and lower limbs. The causes of lymphedema is primary causes of lymphedema, congenital lymphatic vessel defects, and secondary causes of lymphedema are surgery, radiation therapy, malignancy, trauma. Parasitic infections may cause lymphedema, example filariasis. Pathophysiology of lymphedema is lymphatic obstruction may cause fluid accumulation. This will lead to chronic inflammation. The chronic inflammation in the lymph leads to fibrosis and it will form the thickening of the tissue and it leads to lymphedema. Next, clinical features persistent limb swelling, heaviness and tightness sensation, skin thickening, increased risk of infections. Next, lymphadenitis, inflammation of lymph nodes due to infection or immune activation, can be acute or chronic. Lymphadenitis can be acute or chronic. The causes of lymphadenitis are bacterial, staphylococcus, streptococcus infections, viral, EBV and CMV, and chronic infections are tuberculosis. Next, pathophysiology of lymphadenitis. Pathogen entry into the lymphatic system causes the antigen presentation on lymph nodes, and this leads to the lymphocyte proliferation. Proliferation of lymphocyte causes the inflammatory response leading to node enlargement. Clinical features are tender, swollen lymph nodes, fever, malaise, skin redness, and over lymph nodes. Next, lymphoma, malignant cancer of lymphoid tissue, is caused by uncontrolled proliferation of lymphocyte. Risk factors of lymphoma are genetic mutation, immunodeficiency states, viral infections, autoimmune disorders. Types of lymphoma are Hodgkin lymphoma. This reads Sternberg cells present in this Hodgkin lymphoma. Non-Hodgkin lymphoma, multiple lymphoid cancers groups are present in this. Next, pathophysiology of lymphoma is DNA mutation in lymphocyte leads to loss of apoptosis control. This leads to the continuous cell proliferation. Continuous cell proliferation leads to the formation of tumor and systemic spread. Clinical features of lymphoma are painless lymph node enlargement, fear, night sweats, weight loss, and fatigue. Next one, tonsillitis. The inflammation of the palatine tonsil is called as tonsillitis. Tonsils act as first line immune defense. The causes of tonsillitis is viral and bacterial. In viral, it is caused by adenovirus and influenza virus. In bacterial, it is caused by group A streptococcus. Pathophysiology of tonsillitis is pathogen invasion into tonsillar tissue, which leads to the immune cell activation. The activation of immune cell will leads to inflammatory mediator release, and this inflammatory mediator release causes tonsillar swelling and inflammation in the tonsil. Clinical features: sore throat, fever, difficulty in swallowing, enlarged tonsillitis. Next, splenomegaly. Enlargement of spleen due to increased immune or blood cell destruction activity is called as splenomegaly. Enlargement of spleen is called as splenomegaly. The causes of splenomegaly is infection, that is malaria, EBV, and typhoid. This infection may cause splenomegaly, liver cirrhosis, that is due to the portal hypertension. Liver cirrhosis may takes place. This may lead to splenomegaly, and hematological malignancies may lead to splenomegaly. Hemolytic anemia may cause splenomegaly. Pathophysiology of splenomegaly is increased splenic overload may cause increased macrophage activity. This will lead to enlargement of splenic tissues. Next, clinical features: left upper abdominal fullness, early satiety, and fatigue, anemia in hypersplenism.